Welcome, my name is Janneke de Boer and in this video I will present my ISBNPA 2020 presentation titled Does Co-creating an implementation plan with school staff improve the implementation of a school-based sleep intervention? This presentation was one of 3 presentations in a symposium about co-created interventions targeting sleeping behavior. Over the last decades, various public health interventions have been implemented in the school context targeting different health-related behaviors. Even though these interventions show positive effects, often schools' use and implementation of these interventions is lacking. Traditionally, interventions are developed using a top-down approach, by which involvement of stakeholders is directed by researchers defining specific terms where input is needed, like providing feedback on specific intervention components that have been developed by researchers. Nowadays, a co-creation approach is used more often for the development of such interventions, by which interventions are developed and implemented with key stakeholders. In most cases, the stakeholders represent the target group where the intervention focuses on. However, implementers should not be forgotten as they are very important to expose the target group to the intervention. Within the school context, implementers of an intervention are often school staff. Previous research in which a co-creation approach was used to develop and implement a healthy sleep intervention at school has recommended to involve school staff from the beginning of the co-creation process. Based on this recommendation, the current study was designed. By involving school staff from the beginning of the co-creation process, we assume that they will be more familiar with the intervention itself, which might lead to greater support of the intervention and adequate implementation. The study frames within an intervention to promote healthy sleeping behavior in Flemish adolescents. The original intervention was participatorily designed 5 years ago in a secondary school in Flanders in Belgium. As Leah explained during her presentation, we adapted a sleep intervention to a new context using a co-creation approach. The study has 2 foci. First, the co-creation with students to adapt a sleep intervention, and the second one, co-creation with school staff to design an implementation plan. This presentation focuses on the co-creation of an implementation plan. The aim of the study I will present today is to investigate how school staff experience the co-creation of an implementation plan. The co-creation process with school staff started in December 2022 and finished in February 2023. To structure the co-creation process, we used implementation mapping, and this is what our co-creation process looked like. During the first session, we started with a needs assessment. During this needs assessment, we focused on the barriers and facilitators of implementing an intervention at our co-creation school. In other words, we were investigating the barriers and facilitators for implementing in this specific context. These barriers and facilitators were clustered by teachers, and every cluster formed a theme that was important for the development of an implementation plan. Themes were time, knowledge and others, school culture, and outcome expectations. Based on requests from the 6 teachers who were involved in our co-creation process, we focused on capacity building during the second session. This because they were really interested in learning more about sleeping behavior. This session does not fit within the tasks of implementation mapping. During the third session, we matched the existing intervention components with themes that emerged during the needs assessment. So teachers explained if the original intervention components fit their school culture, if they had enough knowledge to implement or that they needed help from someone else, if they had the time to implement the component, and whether they thought the component should have an impact. When we were performing these exercises, the students were still adapting the intervention, and therefore we decided to work with the original intervention components. When some of the components changed later during the process, we discussed this with the teachers. After this activity, we started formulating implementation aims. Because we were not able to finish all the implementation aims collectively, we decided that the researchers should finish them so we could discuss all the implementation aims during the fourth session. That's what we did, and after the fourth session, we agreed on all the implementation aims. The fifth session was a cross-pollination session, in which teachers and students worked together. Students pointed out that school stress was an important topic for them and had an influence on their sleeping behavior. Therefore, we talked about school stress during the session to design new intervention components that were focusing on this topic. During the last session, we discussed what implementation materials were needed for the implementation of the intervention. The materials were created by researchers and checked by teachers to see whether they met their expectations. Furthermore, we discussed how the implementation of the intervention should be evaluated. As you can see, task 3 of implementation mapping, selecting methods, is missing. For the selection of methods, knowledge about these methods is needed, and due to limited time, we decided that researchers were responsible for selecting the methods to make sure that the implementation materials were rigorous. The co-creation of an implementation plan took place in a secondary school in Flanders in Belgium. The school has both a general education track and a vocational education track. Teachers from both tracks were involved in the action group. Our action group consisted of 6 teachers and 2 academic researchers. They were responsible for the creation of an implementation plan of the adapted sleep intervention. To analyze the experiences of school staff during the co-creation process, we used the recordings from our 6 co-creation sessions and the focus group to evaluate the co-creation process. On these data, we conducted thematic analysis, using a theoretical approach as there was a specific research question we wanted to answer. We did not look beyond what participants had said, so our teams were identified with the explicit meanings of the data. This brings me to the results. First, we found that teachers were motivated to be part of the co-creation process. They were motivated because of different reasons. Some of them were interested in the topic of sleep. Others were interested in co-creation in general, and others liked to work with students on a different level. I give you some time to read the quotes on this slide. Furthermore, several barriers were mentioned during the co-creation process. We found that it was difficult to plan the sessions due to high job demands for teachers. During the sessions, we noticed that teachers often left early or came in late due to other unforeseen obligations. I give you some time to read the quotes on this slide. Teachers who were part of the action group experienced a certain level of ownership as there was a high level of engagement. Furthermore, teachers took initiative to complete certain tasks, such as introducing the classes about sleep to their fellow colleagues. However, in some of the quotes, they mentioned things like your project or your preparation, which could indicate that at these moments they experienced a lower level of ownership. I give you some time to read the quotes on this slide. During the co-creation process, teachers in the action group felt that the principal of the school supported the co-creation of the implementation plan, as the principal suggested conditions to improve the implementation plan, like a collective moment to introduce the intervention to the entire team. However, teachers who were part of the action group were not sure about the support of their fellow colleagues, as they mentioned a couple of times that they did not know if their colleagues felt the need to implement adequately due to lower engagement in combination with a lot of other tasks that needed to be completed. I give you some time to read the quotes on this slide. This brings me to the discussion. The aim of our study was to investigate the experiences of school staff during the co-creation of an implementation plan. Based on the results, we can say that teachers had different interests that motivated them to join the action group. Furthermore, there were several barriers that made it sometimes difficult for them to contribute to the process on full capacity. Despite the high job demands, they still experienced a certain level of ownership and felt supported by the principal of their school. However, to implement the intervention adequately, support from the entire team is needed. Teachers doubt whether their fellow colleagues will be able to implement with fidelity because of lower engagement. So for future research, we recommend to engage the entire team of teachers to a greater extent. This can be done by giving regular updates on the project during collective meetings. Even though the study is still ongoing and results are just preliminary, I like to share some do's and don'ts with you based on the things I have learned while conducting this research. Start as soon as possible with the co-creation process. And start as soon as possible with teachers, maybe even before you start the process with the students. In our study, teachers pointed out that they would have liked to be involved all the way from the beginning, so directly after the principal gave approval for our research. If they had more knowledge all the way from the beginning, they could, for example, help with getting informed consent from parents and children. Furthermore, do not refrain from using interactive methods, especially when content might be theoretical. During our process, when we were formulating performance objectives, it took a long time and teachers thought that the task was quite boring. So if I should do this again, I should choose a nice method to make this exercise more fun. Lastly, I'd like to thank all the researchers who are involved in this project, especially Leah, because we did all the data collection together. I would also like to thank our action group, because without them, this project would not exist, and my master student Celine van Zandt for her help during the process. Thanks so much for your attention, and if you have further questions regarding my research, please get in touch.